I will be informing you about pregnancy and giving birth. Pregnancy is a long but rewarding journey. This process can take up to 40 weeks, but some babies are premature. At the end, the work is worth it because a beautiful baby is born. Labor and giving birth is very rough but can be eased with pain medication. Labor is different for every woman. It can last for hours and even up to days. The baby is born through natural birth or through a cesarean. First, the first trimester. WebMD says that the amniotic sac and placenta are developed in the first month. They also say by the end of the third month of your pregnancy, your baby is fully formed. Your baby has arms, hands, fingers, feet, and toes, and can open and close its fists and mouth. The fingernails and toenails are beginning to develop and the external ears are formed. Morning sickness and nausea start to happen. This is different for all women. Some never even experience this. For others, it can last throughout the day and even throughout the night. Parents Magazine tells people that morning sickness comes from the increase of hormones. They also state that stress can play a part in this as well. Women may have cramps and sore breasts. Cramps will happen in the lower stomach because of the organs adjusting to the baby that is forming. The lower back will also cramp due to the muscle stretching. The breasts are starting to change and also grow. Next, the second trimester. Other symptoms may start, but the ones from the first trimester will start to fade. Heartburn starts to happen more frequently, but eating less acidic food can help make the heartburn not as rough. Constipation can occur due to all the vitamins being taken and the organs being squished by the growing baby. Dr. Holzhauer in Columbus, Mississippi, said swelling of the feet and ankles is likely to occur. Nosebleeds can also happen, but usually do not. Dr. Holzhauer also said lower back cramps may increase due to the size of the baby and more weight and pressure is being added. Nausea should become less frequent since the body is getting used to the hormones and adjustments. Energy should return to normal by this point. The breast will become larger and may even go up a full cup size. The tenderness in the second trimester should not be as bad as in the first trimester. The breasts get bigger to start preparing for the breast milk. The breast might begin to leak, but this usually does not happen until the third trimester. The third trimester. Braxton Hicks contractions might start occurring. This happens to help prepare the body for the real labor. They are not as intense as real contractions and are not regular. The women will experience more vaginal discharge. Towards the end, the woman will see what is called the mucus plug. Heidi Murkoff and Sharon Mazel, the authors of What to Expect When You're Expecting, wrote, "The mucus plug, the clear, globby, gelatinous blob-like barrier that has formed your cervix throughout your pregnancy occasionally becomes dislodged as dilation and effacement begin. This means that your cervix has started to dilate. The breast will start, most symptoms have gone away and some new ones have started. The breast will start to leak a yellowish fluid, which is what the baby will receive the first few days after birth, until the milk comes in. Heartburn will continue, but nausea, constipation, and low energy should not be present. Also, the women will be feeling more uncomfortable as the due date approaches." Lastly, labor and giving birth. Labor pains will start, and after some time, which varies woman to woman, labor will get stronger and closer together. As they get closer together, this is the sign that delivery will happen soon. Different pain medication options will be presented, such as medicine through an IV or an epidural. Once the cervix is dilated to 10 centimeters, delivery will begin. The mother will have to push the baby through the birth canal. If something happens, an emergency cesarean will be performed. and episiotomy may be performed to prevent vaginal tearing. Murkoff and Menzel explained, in episiotomy, a surgical cut in your perineum, the muscular area between your vagina and your anus, to enlarge the vaginal opening just before the baby's head emerges. Usually after 3 pushes, the baby will be out, but this also varies mother to mother, and the placenta will be delivered. In summary, I have informed you about the first trimester, the second trimester, the third trimester, and labor and giving birth. Although this is a long process, the time will fly by. Also, although labor and giving birth can be painful, once it's over, the recovery is easy. Thank you.